Hey everyone, this is Acterys here, Managing Director of Architecture and Platforms here at FP Automation. Welcome back to our series on Healthcare Provider Unified Analytics within Microsoft Fabric. In this video, we will be talking all about caseload reporting. But before we get into the contents of this video, I wanted to quickly recap on our previous video where we talked all about utilization and capacity trends. In our previous video, we showed and highlighted to you where exactly there could be potential gaps from a revenue perspective and a utilization perspective in your business. So whether that's not enough appointments coming in the door to be able to fill capacity for providers, meaning that this is a demand issue and can be focused on from a sales and marketing perspective, or if there's a potential operational issue where cancellations and no-shows are resulting in not enough appointments going to the providers themselves, causing there to be gaps in time, which are missed claims opportunities for you to be able to take advantage of for your business in order to maximize revenue and provide great patient care. In this video, we'll be talking about caseload reporting, which is an extremely helpful operational report enabling your operations and admin teams to take advantage of your existing patient data and ensure patients are continuing to book appointments with your particular organization to continue to get great patient care and get back into a great state for their state of health. In this particular report, what you can see right here is we're currently looking at our total patient pool for the entirety of the next 2 years, as well as the ability to slice by facility, as well as provider type. We can see KPIs at the top right here showing total patients, patients with future appointments, patients with no future appointment, and the percentage of patients who have no future appointments versus the ones who do. What this sort of analysis enables you to do is see exactly who your patients are, the first appointment that they have after today's date, what appointment they have that they're scheduled for to have after today's date, and who they will be seeing, as well as any second and third appointment they have coming up. This information enables you to see exactly timings around when patients have their next set of appointments and enables you to be able to book future appointments in place to ensure that you are filling your backlog and ensuring that patients are getting great care. This accomplishes two things. This satisfies the care that your patients are looking for that providers can give, and this allows you to be able to maximize the productivity of your providers, enabling you to be able to charge accordingly for the services you are providing on here. By enabling your admin team to have this data at their fingertips, you are able to then go ahead and focus on the right areas, make the right calls and emails to the right patients, and ensure that you're continuing to book that information while seeing this data updated in your ERP and flowing into your analytical tool, Microsoft Fabric here. So as an example, we can see for this particular patient that they have a second appointment scheduled, but is there an opportunity for us to get a third appointment scheduled? This also enables you to see other patients who do not have future appointments. You now have a listing of patients that enable you to be able to go after and understand where exactly they're at, why there's not a future appointment scheduled, and it could be as simple as they forgot, and this could be an easy win for your administration team to do. This enables you to trade off having to go focus on sales and marketing efforts and instead take advantage of your existing patient base who are already familiar with your service, enabling you to maximize revenue opportunity without spending any additional dollars and using your operating expense in-house to be able to translate any sort of patient that currently does not have an appointment into an appointment, leading to great patient care and revenue opportunity for your organization. We've set this report up countless times for healthcare providers. This has led to a multi-six-figure EBITDA and results as a result of us making these changes here. So I hope that you enjoyed this particular video here on caseload. In our next video, we will be talking all about patient appointment frequency. Thank you, and this is Alp signing out.